Welcome students. I am going to go through chapter 10, modifiers. This is a really important unit and it is a unit that you are going to utilize for surgery codes, evaluation and management codes, for so many different codes. So one thing with this lecture today, always come back and utilize it. It'll be very important as we hit every unit in this semester. So a couple of different things I want you to do. I want you to get your CPT book and your step-by-step textbook. So with your CPT book, you need to open up to Appendix A. This is the back part of your CPT book. It will be, you have how many appendix back here? I'm just kind of looking through here. Looks like we have Appendix A all the way through Appendix O. So we're going to start off with Appendix A, which has your CPT modifiers. And then I want you to go to chapter 10 of your step-by-step book. This explains the modifiers also. There may be things in there that I don't talk about today that will really help you. With this chapter, one thing I always tell students, really look at those coding shots. They really, really do help. So let's go ahead and start this modifier chapter. So what are CPT modifiers? So as you know right now, a CPT code is for 5 digits, correct? And with those 5 digits, a modifier is used to describe alterations to a CPT code. So what I mean by that, it will be like a dash and then 2 numbers. But if we do a HCPCS, it could be letters. So right now we're gonna just start with the modifier section. Okay, so modifier functions. Why do we use them? So with this modifier functions, we're looking at, they put something with the code, like they could alter it. Bilateral. So if you have a right and left knee replacement. Multiple, if there's multiple CPT codes. Only portions of a service, more than one surgeon. Unusual service. So let's dig right into the first modifier I'm going to talk about, which is increased procedural services. This indicates services are significantly greater than usual. If you use a 22 modifier, you have to also send in a written report with supportive documentation. And it describes the increased physician work. So what do we use this for a lot of times? Increased risk to the patient caused by complications. So let's say they're doing a procedure and the patient had an arrhythmia while they were doing surgery. So the doctor had to do a few extra things for this surgery. So at that point, there could be excessive blood loss. Welcome, students. We are going to go ahead and start chapter 10, modifiers. So a couple of different things here. I want you to grab your CPT book and I want you to grab your step-by-step book. So in your step-by-step book, you are going to go to chapter 10, CPT modifiers, and you can kind of follow along, write notes in your book as we go, or your CPT book. I always tell students make tons of notes. You know, the more notes, it'll help you understand, help you remember. In your CPT book, you need to go back to Appendix A. Appendix A, of course, is towards the back of the book. You can look to see there's many appendixes back there. So go ahead and go to Appendix A, and this gives you all your modifiers. Let's get started. CPT modifiers. What are they used for? They're used to describe alterations to the CPT code. Again, there's a full list at the back of Appendix A and also in your textbook. All right, what are the functions? So they a lot of times give clarification. So altered if a CPT code was, we need to alter it. We add a modifier. If there's a bilateral procedure done on the same day, we need to put a 50 modifier. There's multiple procedures done on the same day, we want to add a 51. So more than one service, unusual service, there's lots of uses for modifiers. So let's start with, as you've learned so far in this semester, that a CPT code is 5 numbers, right? So with a modifier, you're going to have those 5 numbers, and then you're going to go dash. And in this instance, we're going to start off with increased procedural service, 22. Keyword here, procedural. So I want you to write in your CPT book for 22, procedural, or highlight it. You also want to write not an E&M, which is evaluation management, which we will talk about soon, modifier. It is not an E&M, evaluation modifier, evaluation management modifier. Sorry about that. Okay, so what is 22? It indicates services like procedure was significantly greater than usual. When you use a 22, it has to be accompanied by a written report, supportive documentation. It also has to describe increased physician work. So let's talk about 22. So let's say that they're doing a procedure. Let's say a lady came in to have a hysterectomy, a removal of her ovaries. So she had a Salping oophorectomy, and there was excessive blood loss, more than usual. They had to stop the surgery, get the blood loss to stop before they could proceed with the surgery. So what they want to do at that point, they put with the surgery code, which would be a hysterectomy with the Salping oophorectomy, they're going to put -22, and then this flags that documentation has to go with that code, because usually the doctor a lot of times will add an amount to that, saying, you know what, I want to add $300 because this surgery wasn't a basic surgery. There was excessive bleeding. So at this point, the report will go ahead and go with it to let them know that more complications or that this did warrant the extra cost. 23, unusual anesthesia. This is where no anesthesia or local would be the norm. Example, you have a highly agitated senile patient. This again is only used on anesthesia codes. They begin with 0. Written report with a submission of the modifier may again be required as it was with the 22. Okay, 24. This one here, keep in mind, unrelated E&M. Okay, E&M is evaluation and management, so 24 can only go on evaluation and management codes by the same physician or other qualified healthcare professional during a postoperative global period. So the E&M service is not related to the surgery, is separately billable. You only use 24 on the E&M. The E&M provided during any post-op global period, no separate payment for E&M related to the surgical procedure. So here's a great example. You have a patient who's in the global period for hip surgery, is now seen for a fractured collarbone. So let's talk about this. Remember, hip surgery, that's going to be a 90-day global. So with that, as I've talked about before, 3 days before, 90 days after a hip surgery, because it's a major surgery, everything is included in that one price. Okay, so let's say the price of that hip surgery was $7,000. That includes anything pre-op and post-op for 90 days related to the surgery. So that means if the patient comes in 2 weeks after the surgery for a check, they can't charge the patient. It's included in that global. So the reason we can use a 21, because they're coming in something totally different than for that hip surgery. They're coming in for a fractured collarbone. Okay, so they come in, see the doctor goes ahead and submits, but it's during the global period. Usually it's going to get